Welcome back. This is part 4 of the BIAV Advocacy webinar series. And in this section, we're going to talk about the budget. And I'm going to implore you at the beginning to sort of just hang on because the budget process can be a little complicated. I love this quote from Elizabeth Warren. It says, if you're not at the table, you're on the menu. And that's why we work so hard with the budget process to make sure that none of the funding that we have worked so hard for in the state of Virginia is threatened in any way as long as we can help it. We've got just a little under $6 million to provide community-based services for folks with brain injuries in the state of Virginia, and we need every one of those dollars. We actually need more, and the budget process is how we go about getting more. So in 2020, these are the things that we asked for from the budget process. We wanted a little over $6 million for a system of care that would include in-state neurobehavioral program, specialized case management services provided in the community for people with brain injuries. We wanted supported living services and money to address workforce retention issues. That means that we have staff who are being underpaid and who are leaving the jobs working for community brain injury programs because they can get paid more money going somewhere else. And we also asked for money to conduct a study that would require some screening of individuals who've been a victim of domestic violence and finding out whether or not they have a brain injury as a result of that assault. Sadly, we ended up not getting any money from this budget. 2020 was the year of COVID, as you know, and while the first budget that the General Assembly passed had $1 million new for brain injury in there, after COVID hit and the General Assembly had to come back to town and renegotiate the budget, that $1 million went away. Virginia operates under what's known as a 2-year or biennial budget. A budget that's passed for 2020 is good until 2021, and then that budget is tweaked ever so slightly for 2022. Each year, the governor proposes the budget bill and introduces it to the General Assembly in December. And each year, we have sort of 2 budgets that we have to consider and attend to. One is the budget bill itself, which appropriates money for the next fiscal year. And the other one is known as a caboose bill, which encompasses adjustments that are needed in the current budget. For example, one of the things that Virginia had to do when it came back in special session as regards COVID was it had to look at the change in revenues and the change in expenses for this current fiscal year because of COVID-related expenses. Those were going to show up in part in the caboose budget for this fiscal year, as well as the budget bill for the next fiscal year. So as I said, in December each year, the governor introduces a proposed budget bill, and it goes both to the House of Delegates and to the senators in the Senate of Virginia. We ask delegates and senators to patron budget amendments for us. Remember, a patron is a sponsor. So we go to a delegate or senator and we say, we need a budget amendment to be sponsored that asks for money for workforce retention. So when we find patrons, then they submit their amendments to the budget bill to different committees in each house. In the House, it's the House Appropriations Committee, and in the Senate, it's the Finance and Appropriations Committee. So those budget amendments are reviewed by the different committees and all of the subcommittees. In both the House and the Senate, they have Health and Human Services subcommittees, and that's who we focus on. The individuals in the House and Senate who sit on these appropriations subcommittees for Health and Human Services are looking at all of the requests that come in from all of the agencies under the Secretariat for Health and Human Services. That's going to be organizations like Behavioral Health and probably the Virginia Association of Community Services Boards. It's going to be organizations like the ARC, who is working with the Department for Medical Assistance Services on Medicaid waivers. It's going to be the Department for Aging and Rehabilitative Services, which is the lead agency for folks with brain injuries. So the senators and the delegates on these appropriations committees are looking at all of the health and human service money that was proposed in the governor's budget, as well as the amendments that different members of the House and Senate request. At the halfway point of each General Assembly session, the respective houses will report and vote on their versions of the budget bill. Normally, the House has one version and the Senate has another version. And at that halfway point, each bill crosses over to the other body for their review. So that means that the budget that the House approved gets reviewed by the Senate, and the budget that the Senate approved gets reviewed by the House. Generally, what happens is both houses just outright reject the other house's version of the bill, and then they create what's called a conference committee. It's usually made up of 6 members of the House of Delegates and 6 senators. They're called conferees, and these legislators negotiate a final version of the budget to present to both the House and the Senate. The House and the Senate will vote on the conference committee's budget bill, and when it's passed, it's communicated to the governor. And just like bills, the governor has the ability to propose amendments to the budget bill. And those amendments are sent back to the House and the Senate, who can either accept or reject the amendments that were proposed to the budget bill by the governor. And once the governor agrees to those amendments, he signs the budget bill into law. And that concludes section 4.